One of the biggest battle lines when it comes to the president's tax cut and spending bill are the cuts to Medicaid and the very real impact those cuts will have on millions of Americans, especially in rural communities. Nearly 12 million Americans are expected to lose health insurance with this bill. That includes almost 2 million in rural areas. And one report estimates nearly 400 rural hospitals would be at risk of closing if the proposed cuts go into effect. I want to play for you what one Democratic congressman just said what this will mean for his community.
35 rural hospitals in my state are going to close, and we know what's going to happen. People are going to get hurt. Children are going to have accidents. People are going to have heart attacks. When minutes matter, they are going to have to drive an extra 30, 45 minutes. That is the difference between life and death.
And he represents Kentucky. Louisiana is another state that could face the worst of it. Louisiana ranks second in Medicaid enrollment in the country at nearly 32%, a reflection of the state's higher poverty rate. And there are 33 rural hospitals there flagged as financially vulnerable. One of those hospitals is Hood Memorial Hospital in Amite, Louisiana. And joining us right now is the CEO of Hood Memorial, Mike Whittington. Thank you, Mike. I really appreciate it. Talk to me first about your hospital. You also told me in the break that you're a nurse practitioner, so you know all facets of it. Who do you serve? What services do you offer? What does Hood Memorial mean to the community?
So Hood Memorial is a 25-bed critical access hospital. We're located in northern rural Tangipahoa Parish, and we're founded in 1971 as a normal hospital, and then converted to critical access as reimbursement began to decline in the 90s, and ultimately forced a lot of rural hospitals into that status. So our primary service is primary and preventative care to our citizens. We also have a large swing bed program as well, where we take patients from other hospitals who have who've had extended hospital stays and need extensive rehabilitation or antibiotics or wound care. So we focus. We don't do deliveries, we don't do surgeries, but we run an emergency room 24/7, and also operate a clinic that's open about 64 hours a week.
And rural healthcare has already been in crisis for quite some time and is very vulnerable to small shifts in Medicaid policy because they're operating on smaller margins than bigger urban hospitals. So what do these Medicaid cuts that we're learning more about that's working its way through Washington, what do these Medicaid cuts mean for Hood Memorial?
So ultimately, I want to back up a little bit. Prior to 2016, we did not have Medicaid expansion in Louisiana. Governor Edwards, that was his first official act when he signed into executive order Medicaid expansion. That act alone saved a lot of rural hospitals. And since that time, since Medicaid expansion has been brought forward in Louisiana, we've not had any rural hospitals close. So that what this has done is has allowed us to invest in additional services for our communities, invest in additional new equipment, replace aging equipment. Most rural hospitals are operating in buildings that were built in the 50s through the 70s. So there's a lot of capital improvements that need to be made. Well, if these cuts go into effect, we're still legally required to provide care to our citizens, but ultimately we will be providing that care with little to no reimbursement, and that will set us back 10 years, and then eventually put us on a course to where it's very, very difficult, if not impossible, for us to offer new services or reinvest in our facility and provide additional services to our patients. It's just going to make it impossible to do.
I was seeing the American Hospital Association said that these cuts will result in irreparable harm, and saying could ultimately lead to facility closures, especially in rural and underserved areas. I mean, is closing down, being forced to close, a real threat and concern for Hood Memorial, what you could face?
So I at this point in time, until the bill is actually passed and we truly know the impact of it, I don't feel like closure is a threat at this point in time. What I do feel like is that ultimately, you move from being able to, again, progress and offer new preventative care services to your community to where you're not going to be able to do that. A good example is our clinic. We run our clinic 12 hours a day, Monday through Friday, and a half a day on Saturday, because not every person has a job that allows them the opportunity to go to appointments during the day. Well, so we are there so they can come before work or after work to get their primary care in a setting that's appropriate for that. Otherwise, they would either forego that care or they would wind up in the emergency department. So that's just one small example of the type of services that we offer to meet the needs of the working poor in our communities that may be affected, if these cuts go into play. And ultimately, it drives care out of primary care into emergency departments and other venues that are not the best place to do it. For every dollar that this country spends on primary care, we save $13 in the long run. This is the best investment that we can make in healthcare, is the primary and preventative care services. And if we don't address those needs in our rural populations, we're going to continue to widen the gap of 2.5 year less life expectancy for rural residents. And our objective here is to close that gap and to make sure that people who live in these communities have the same life expectancy as their urban counterparts.
As they should be able to expect. Mike Whittington of Hood Memorial in Louisiana, thank you very much for your time today.
I wish every senator who voted for this had to shadow a doctor like me for just one day. They'd see the patients that I had to talk to about affording their chemotherapy, mothers rationing their kids' insulin because they can't afford it, and people dying too young, not because medicine failed them, but because finances did.
Okay, so Medicaid may in fact end up looking very different if the president's spending bill passes, and now Republicans seek to add a new work requirement that could impact millions. It's part of an effort to rein in the nation's safety net program with up to $1 trillion in cuts. While the bill would cap and reduce taxes states impose on hospitals, it would also require most adults to work, volunteer, or study 80 hours a month to qualify for enrollment. So what does that mean for the millions of people who rely on the program? Well, we're joined now by Julie Rovner, Chief Washington Correspondent for Kaiser Family Foundation Health News. Julie, good morning.
Good morning.
So I want to talk about this work requirement. The idea of work requirements is not new. States have done it for a while. Can you talk about what's distinct about how it's done in this bill?
Yeah, most people on Medicaid already meet these requirements. They either work or they go to school or they care for someone at home. The problem isn't the work requirement itself. The problem is the paperwork that's involved with the work requirement. What we found in states that have tried to do this is that people have difficulty reporting these activities or proving that they've done these things. They have trouble uploading documents. Someone described it as like having to file your income taxes every month. That's how eligible people end up losing coverage. And indeed, the Congressional Budget Office says that perhaps as many as 12 million people could lose coverage if this bill becomes law.
I also want to talk about the effect on hospitals, because I don't always understand hospital math, right? How do changes to Medicaid affect everybody else? What does it mean for that industry?
Well, people get sick regardless of whether they have insurance. So if they have Medicaid and they get sick and they come to the hospitals get paid. They don't necessarily get paid as much as they would if the people had private insurance or Medicare, but they do get paid something. If these people lose their insurance, they're still going to come to the hospital. The hospital's still going to treat them, but now they won't get paid. This is a huge problem for hospitals that have large populations of Medicaid patients. That includes inner city urban hospitals, but also rural hospitals where a lot of people are on Medicaid. So if these people become uninsured, the hospitals could well go under.
And finally, the math. I don't know if it's semantics about whether these are cuts or changes or increases. Help me understand the talking points.
Yeah, this goes back years and years and years to when Congress used to try to cut Medicare, and there were arguments that we're not really cutting it. It's true that Medicaid spending will continue to grow, but if it doesn't keep up with the cost of healthcare or the numbers who are eligible, then there will be less money for these hospitals, for these people. So yes, in the aggregate, Medicaid spending will go up, but that doesn't mean that people won't lose their coverage, and hospitals won't be hurt by the fact that they're going to have to treat patients who don't have any insurance.
Julie Rovner is Chief Washington Correspondent for Kaiser Family Foundation Health News. Thank you, Julie.
Thank you.